Bismillah ar-Rahman ar-Rahim, my dear vascular colleague. I'm going to speak today how artificial intelligence can help a doctor to pass vascular examination or any medical examination. As we all know, artificial intelligence is a new tool, but a lot of doctors doesn't use it in passing their exam. So my intended learning objective of this free course that a lot of vascular surgeons does not use AI in their study. AI is a great tool and I will show how it will help you as an example in case of doing examination of a patient in the exam. And candidates should all will know a benefit of artificial intelligence in preparation of vascular examination. Uh, you should be able to crack the code of vascular examination. Vascular examination is definitely a necessity for your career, and you should be able to pass them the first shot. This is the usual, and not to ever fail. Sometimes candidates fail in certain gaps of their knowledge, like they are not fully prepared for having OSCE examination, but they are not a bad surgeon and they don't even have a bad knowledge, but they were unable to put this knowledge in a productive way. And this is what makes someone feel bad, that you are a good surgeon, a good vascular surgeon, but you failed the exam. With the help of artificial intelligence and my experience in examining a lot of candidates in many examinations, the Egyptian Fellowship, the MRCS, the European Board of Vascular Surgery, and much more, and master degree and MD degree, I will try to summarize the common mistake for you to avoid. And hopefully, after having this course, you should pass the first time. This is the usual with a high mark. Now, the examination nightmare is over. If you are well prepared for an examination, you should pass. Examination and anxiety is a good sign, not a bad sign if it is within limit. Too much anxiety will make you unable to think properly, to speak properly, and very low anxiety level will make you not care about the exam, and this also is not good. So this course should be able to make you enter the examination with confidence. This is an interactive course, so you can put all your question in the comment section of this video and I will try to summarize it for you. You can actually make an attachment if you perform some of the steps of how to examine the abdomen, how to examine upper limb or lower limb, and I will show you what are the mistakes that you try to avoid. It's like a virtual OSCE station training. Now, this is an interactive course, so you need to ask a question and show your skills in order to be evaluated before the exam. The main advantage of this course is that it is an interactive, and this is a lot better than just having a couple of days before the exam to run all the station, all the information. No, and I will show you when I asked artificial intelligence how much time you need to prepare for an average vascular exam. It's around 6 months. So 6 months studying 5 hours per day is usually the usual. Don't rely on just a few days or even 1 week before the exam that it will get you to the level to pass. The advantage of this course is I'm using artificial intelligence as a tool in order to give you a personalized feedback and to show you how you can succeed in vascular examination. So let us start with this course. The advantage, number one, you must know why you are going into this exam. Unless you are keen to know the benefit, you'll not become eager enough to pass. So let us take an example. If you want to go for MRCS examination, It's a great step in your career. It will open you to have jobs in United Kingdom and other European countries. It's a lot better route than having a lab test where here you are examined by general medical knowledge rather than specific surgical knowledge. And if you get a lab and you want to specialize in surgery, you need to go for MRCS. And in the unfortunate event, if you fail the lab, and even if you pass MRCS, you will not be able to work in United Kingdom, because once you fail the lab, you must pass the lab. So I would advise the route of MRCS. It will open a lot of opportunity, a lot of very good post-graduation training, and it will open really quite big route of success, as it happened in my life and a lot of my colleagues. It really changed your career to a much better arena. So I would advise you very much to go into an exam, same with European board, same with Egyptian fellowship. It will open a lot of opportunity for your career. So number one, you must know the exam is very important for you. How much you need to study? If you go to, for example, BARD and ask how much I need to study for this exam, the answer is many candidates dedicate 4 to 6 months of concentrated effort to prepare for vascular examination. This can involve a daily study session between 2 to 4 hours. I would probably will go to 5. This is my advice. Focusing on combination of theoretical knowledge, clinical skills, and mock examination. Now, the examination in medicine have changed in the last, let us say, 20 years. Now there is a part of called OSCE exam. So I'm not just examining your knowledge, but I'm also examining your clinical skills, your judgment, and many other skills that is needed to pass the exam. So this is very important for you to know. Which book you need to read from? You can ask artificial intelligence. For example, I want to go to MRCS Part B examination. What do I need to study? Well, if you ask artificial intelligence, it will tell you clinical examination communication skills for MRCS by B.H. Miranda. This is very important book. It provides comprehensive coverage of clinical skills, history taking essential, and I will try to summarize some of the important points of these 3 books. Second book is Get Through MRCS, which is Anatomy 2nd edition by Simon Overstall. And the third one is Oxford Handbook of Clinical Surgery by Mary R. Owen. These are very important 3 books that will help you to pass the exam. You can ask again for Egyptian fellowship what you need to read before the exam. Also, additional resources. The beauty about artificial intelligence, it will give you addition. So you have 3 books, then you need to study well. But not only these 3 books, there is other additional resources like OSCE for MRCS Part B, Bailey and Love, a guide by Jonathan Fishman, very important book to read. Mastering MRCS Part B by Christopher Vaughan is also an online source, and you can buy the book and you need it. It's very helpful. Revision Surgery by Paul Jenkins is a comprehensive online platform, provide you access, video lecture, case studies, and again, I will try to touch to some of the pearls found in these books. These are the 3 books that you advise to read. But not only that, but if you go to the Royal College website and you ask Royal College of Surgeons, what do I need to read? Well, actually, they made a special website for MRCS, OSCE examination, which is the examination consists of 4, let us say, 4 categories. Category of anatomy and surgical pathology, 5 station. Applied surgical science clinical care, 3 station. Clinical and procedure skills, 5 station. Communication skills is 4 station. So as I said, the examination have changed. There are different regulation with the Egyptian fellowship, with the European board, with FRCS Vascular, and we'll try to go one by one and you select which one you are eager to learn. There is a complete information for MRCS in just one link. This is the link. www.intercollegiateexamination.org.uk MRCS. Here you will find all what you need to know about the examination. Now, if you speak about the OSCE exam, it's about 17 stations. Each station you are being examined. You must know the format of the examination before you go through it. And this is extremely important to read about it. And there is a guidelines in the website of the Royal College of Surgeons that show you the exact scenario of the exam. So here, this is a common information, OSCE Station 17. These are divided into 4 broad categories, as we told them: anatomy, surgical pathology, clinical and procedure skills, and also you have the communication skills and applied surgical science. These are the constituent of the exam. I will show also the European Board, the Egyptian Fellowship, and the FRCS Vascular. But this because this is a common exam which is being held in Egypt this year, 2024, around 5 times. That is why I'm giving more information on this part of the exam. How you are assessed? How can the examiners tell if I'm good or bad? This is an important question, and you can ask it artificial intelligence. How I'm going to be assessed? And this is a beautiful answer. Each candidate for OSCE examination assessed in 2 ways. Number 1 is using a structure sheet. You give a mark of every step that you do. For example, abdominal examination. How you have examined the abdomen. Have you been able to elicit all the physical signs of the abdomen in a professional way? You're able to do it without harming the patient. You took your permission. All of this. In addition, there is an overall judgment of candidate, which is one of 3 things: either pass, borderline, or fail. They are not necessarily the same. Sometimes you get a high mark, but you fail because you were not compassionate to the patient, or you hurt him, or you caused pain. And sometimes you have a low mark while you have passed because you did not get any fatal mistake, for example. So these are the 2 ways that you are being assessed. So you must know or ask artificial intelligence how I'm going to be assessed in the exam. This is a document that I told you it's important to read for this exam. There is also another document for European Board of Vascular Surgery, another document for the Egyptian Fellowship. And if you ask artificial intelligence what are the documents that contain the candidate guide for the exam, it will get you exactly through this document straight away. Passing an exam is a very easy process with well preparation ahead in advance, and I would advise everyone, don't pay for the exam until you are fully ready to pass the exam. Don't pay and think that payment will push you to study hard. You should study hard before you take your final decision to pay for the exam, and that is why in some event we see candidates failing to continue the rest of the examination. Have enough 6 months before the examination date, studying well, reading well, and practicing well. And ask artificial intelligence a lot of steps of the way that show you how you can pass. Not only this, but you can ask artificial intelligence what are the common OSCE stations coming into the exam. It will tell you the frequency of the common station as well, because the artificial intelligence have all the information about the OSCE station all over the world. Let us take an example, quick example. One of the things that you are going to be examined in multiple variety is how you do physical examination. A lot of doctors fail in this examination. Unfortunately, they should all pass. Now, abdominal examination, there is a checklist. You need to memorize it by heart. It's 15 steps. I will discuss them. And you should do them 100 times to 100 patients until it becomes a natural reflex. When I tell you to examine this abdomen within 6 minutes and then summarize your finding, it should be like a reflex reaction to you. And you must memorize them, as I said, these 15 steps by heart and do them 100 times. So you ask artificial intelligence, what are the questions that would come with an abdominal examination? Again, with any examination, I usually would like to ask you, number one, can you summarize your finding? Any other examination that you wish to perform, usually this is PR, pelvic examination, that you unable to do them during the examination. Possible differential diagnosis, special investigation, or option for treatment. So all goes around patient management, and usually they go into that sequence. And this is just if you ask artificial intelligence, this is what will tell you. Now remember to speak slowly and speak clearly. You're not being judged by how fast you are, but you are being judged how professional you are. Consider the appropriate fact. Make the best of the information gathered. So I'm not showing how you do abdominal examination, but how you gather the information, how you're able to professionally summarize it, how you look professional to the patient in the way you grasp the information from him, how gentle and kind to him. All this is very important. So you are being examined for your skills in communication and your professionalism as well, and how you're able to change your you can accommodate new information and change your management accordingly. All these are very important for you to pass this examination skills. So these are very important. And remember, wiper, which is an abbreviation that you start by washing your hand, introduce yourself, position the patient on the correct side. You should be on the patient right hand side. Expose the patient as needed. Sometimes the examiner told you this enough, you don't need to expose it more. And right side of the bed. So remember, before you start the examination, wiper is an important abbreviation. I've summarized here for you when you ask it artificial intelligence, what are the steps? These are the steps that you should go through them straight away. Don't stand looking as if you don't know how to do abdominal examination. You must memorize them by heart. And here is general, then inspection, hands and arm. This is a part of abdominal examination. Palpation of hands and arm is very important. And number 4, inspection of head and neck. Some of the good style that we advise you to do when you are doing an inspection, tell me what you're looking for. No obvious scar, no abnormality, no contractures, so on. And this way you can grab more marks. Sometimes you examine and don't say anything. Sometimes this will be evaluated, but you're not sure if the examiner know what you're looking for or not. Palpation of head and the neck. Try to make gentle palpation, and in case of the face, don't try to pull the lower eyelid with your finger because you might hurt the patient. You will be stressed, and you can ask the patient, can you pull your lower eyelid for me? Can you pull your eyelid up for me? Without touching really his face. Also because your hand will be sterilized with chlorhexidine. Some people can be allergic to this disinfectant, so try to avoid touching patient face. Inspection pericardium, inspection of the abdomen, palpation, examine the spleen by manual palpation, percussion. All this, and the last step is any further test needed. This is considered the last part of the abdominal examination. So these are the 15 steps that you need to go through them, to memorize them by heart. And let us ask artificial intelligence the question, how can I pass abdominal examination auscultation safely? Beautiful answer. Passing auscultation is all about demonstrating competency in physical examination technique and clinical reasoning. Here are some key pieces of advice to surgical candidates. So this is advice by artificial intelligence for you to pass the exam. Pre-station preparation. Before the station, brush up your knowledge, revise relevant anatomy, physiology, common abdominal pathology, practice the technique, palpation, percussion, auscultation. I like you to go to the exam with your stethoscope, and maybe you can put hand scrub in your belt as well, so you don't forget to scrub your hand before in the exam. And review the station format before going into the examination, and plan your approach, how you're going to approach examining this patient. And artificial intelligence also give you, during the station, maintain professionalism. Dress appropriate, introduce yourself, follow the protocol, which, as we said, the 15 steps. Explain your findings as you go along. Perform a maneuver with confidence. It's very important. And here I would like to invite you, send me a video how you are doing abdominal examination on any model or any plastic. And then I will show you how you are being judged and what score you will have. Integrate your knowledge, which is a combination of history, examination, investigation, how this come together to give a differential diagnosis, and handle the feedback constructively. If the examiner told you something, then take it in constructive way and try to improve your way of presenting and managing this patient. Manage time effectively. 6 minutes is usually sufficient for you to do the examination, not more. And additional tips from artificial intelligence: practice communication skills, speak clearly, concisely, avoid medical jargon, explain finding, try to be clear and simple. Prepare for common scenario, always common scenario like acute appendicitis, cholecystitis, intestinal obstruction, and so on. Dress comfortably. Don't wear a very tight dress that make you uncomfortable to move. And this is important. Get a good night's sleep. Don't study the night before the exam until the morning and come to the exam while you are exhausted. Practice a positive self-talk, and this is important for you as skills to answer the question of the examiner. The last part of the artificial intelligence advice is, remember, OSCE examination looking for evidence of your clinical competency, communication skills, ability to apply knowledge effectively. By following these steps and practicing diligently, you can confidently approach abdominal examination with increase your chances of success. Best of luck. And this is the end of artificial intelligence. I hope this quick scenario help you in passing the exam. I will always use the tool of artificial intelligence in all my examination that I'm going through, and all your career you must pass exam in order to be in a better place, in a better position, and to be very successful in your career. I wish you all the best and hope to see you with the next issue of this free course of AI passing vascular examination.